It's a wonderful sunny day, and you're all set for a great day in the clinic. But you couldn't be happier because you love medicine. Then you remember something. It's April 31st, and you need to get 20 CME credits by June. You don't want to just do a bunch of clicking online to earn your CME hours, because let's face it, you've done that before, and you don't really retain a whole lot of knowledge that way. You also want to have a high quality meeting with great speakers. I'm talking like Nobel Prize winning caliber. Lastly, you dream of a meeting that you get CME at. But the whole event isn't just about CME. You want to create relationships with your colleagues in various specialties. You realize that this is the kind of like asking for the moon. But then you go home and you get a flyer out of the mailbox. You begin to read. Ogden Surgical-Medical Society meeting is mid-May. Okay, that works with your timeline. 29 in-person CME hours. Family activities every night. Big name speakers from multiple different specialties. Huh, that was weird. All of the things you wanted in one meeting. It doesn't seem like any other that you've ever been to before. How did such a meeting come into existence? I'm Scott Moore, and tonight Brian Campbell and I will talk about the history behind medicine in Ogden, and we'll talk about the Ogden Surgical-Medical Society with our highly revered historian and Ogden pathologist, Val Johnson. Everyone, welcome to our wonderful podcast today. We have the treat of talking with Dr. Val Johnson. He's a pathologist that served here in Ogden since the 70s. He's had so much influence on how medicine is practiced here, and we really appreciate him being here. We also want to recognize him for being such a long-time member of the society and of the leadership in the society as well. So Val, I wanted to know, what are the beginnings of medical practice here in Ogden and Weber County? You as the historian of the Ogden Surgical-Medical Society, I would wonder if we could hear about who were the doctors, what about some of the hospitals there?
Thank you for asking, Dr. Moore. I appreciate that. There have been 3 historians for the Ogden Surgical Society. The first one was Dr. George Pfister, who was one of the originators and founders of the Ogden Surgical-Medical Society. Following him was Dr. Ed Morton, and then I followed him as historian. But I'd like to talk a little bit about some of the early history of medicine in Ogden and Weber County. Ogden's first doctor was William McIntyre in 1852, which is about the time that Ogden really was organized. It had been a very small community before then, and part of it had really been just a fur trapper's cabin and fort of Miles Goodyear. But then some other people came into Ogden. James Brown did, and Ogden was first called Brownsville. And then following that, Brigham Young sent Loren Farr to Ogden to establish an actual city. So in 1852, we got our first doctor, Dr. McIntyre. He came after serving in the Mexican War. There was not an official hospital in town, but there was an Ogden Hotel at 25th Street and Grant Avenue, which was used to house sick and injured travelers. And during this time, from 1852 to about 1900, there were as many as 30 women midwives in town also. They were the preponderance of medical providers for some time in the 1800s. In 1882, well, let me just backtrack. In the mid-1800s, almost any man could become a doctor with 1 year's training. But these doctors were mostly herbalists or naturists or homeopaths. And so medical science was certainly not as we think of it today, but by statehood in 1896, it took actual medical school attendance of 2 to 3 years in order to be licensed. In 1882, the city built a 6-room hospital that many called the Pest House. It was at 40th Street in Washington, in Ogden, and it was mostly for smallpox patients and other contagious diseases. In 1883, the Union Pacific Railroad purchased a 2-story adobe building at 28th Street and Adams Avenue and converted it into a hospital. The railroad had their own railroad doctor who was the only person that could admit patients to that hospital, but he could also have an individual private practice on the side, and that hospital only allowed railroad employees, workers, to be hospitalized there. In 1892, the city built another hospital, but it closed in 1 year, in 1893. In 1897, a group of Weber County doctors purchased that facility that the city built and had been closed, and they remodeled it to include an operating room and 6 or 8 patient rooms. Nurses were trained here also. This hospital operated until 1910, when the D Memorial Hospital opened. Now, I want to just backtrack a little. There was also a Japanese hospital in Ogden. There were Japanese people who had immigrated and come here at the early 1900s. They worked mainly as gardeners and farmers, and about a 6-bed hospital was built for them on 22nd Street and Madison Avenue in Ogden. And they had their own Japanese doctor, Dr. Suzuki, who in 1903 had graduated from the Chiba Medical College in Japan. He was the attending physician because he could speak Japanese, and these patients, for the most part, couldn't speak English. So that's a little bit of very early history of hospitals. But then in 1910, the D Hospital was opened. It was opened in memoriam to Thomas D. who had died of pneumonia after falling in the Ogden River and getting chilled and sick and died. And so his wife, Annie Taylor D., had this hospital built. The hospital was built and opened in 6 months. Imagine trying to do something like that today. The rates were $3 a day. Nurses worked 12-hour shifts with 1/2 day off per week. There were 34 physicians on the original staff. The hot springs near the mouth of Weber Canyon also had a building called the Ogden Canyon Sanitarium, which was not really a hospital, but there are hot springs at the mouth of Ogden Canyon. And so entrepreneurs built this sanitarium and advertised it as a healing facility for people who would come and bathe in it and drink the mineral water from it. That was in 1904. It is now the Rainbow Gardens and Greenery Restaurant. Then our next hospital was St. Benedict's Hospital, which opened in 1946. The city felt that there was a need for more hospital beds than just the D Hospital. And so city authorities began a search for how to get another hospital in town. They contacted the St. Benedict's Sisterhood in St. Joseph, Minnesota, who agreed to provide nuns to come as nurses and help to operate a new hospital. That hospital opened in 1946 at the top of 30th Street in Ogden, above Harrison Boulevard. That hospital then closed and moved into a new facility as Ogden Regional Hospital in 1977. And that hospital was run with administrators from the nuns for many years. And that was, I worked in that hospital, and that was a lot of fun. And there was a great feeling there with the nuns having a different kind of what seemed special care for the patients. Many of them were nurses, others were laboratorians, and some were administrators. And they would come out in the community. I remember as a child, the hospital administrator, who was a nun, and another of the nuns would come to my house, my parents' house, and we'd prepare dinner for them. And they would go visit people in the community, and it was very nice. Well, just a very few years ago, the nuns left Ogden and went back to their mother house in Minnesota. But the hospital then turned to professional administrative authority and is now open not as the Catholic Hospital, but as Ogden Regional Medical Center.
Now, Val, you mentioned it was on the top of 30th and Harrison. I think that's interesting that now what was one hospital is now McKay Hospital.
No, that's not correct.
Oh, that's not correct?
The top of 30th Street above Harrison is still the St. Benedict's Hospital building, but it is a set of apartments and I think some assisted living facilities, and not a hospital any longer. Now, the D Hospital also made a move. In 1969, it was felt that there needed to be more space and more modern facilities. So the D Hospital, under the name of the McKay D Hospital, was moved over across the street from Weber College, just below Harrison. And then just a few years ago, I don't know exactly when, but
2002.
In about 18 years ago, a new McKay D Hospital was built where it is now located around 4400 Harrison, roughly. So that's sort of the history of the hospitals in the community.
Well, Val, this is Dr. Brian Campbell. I'm secretary of the Ogden Surgical-Medical Society. Could we segue to the society itself? Can you tell us about the founding of this society? Why was it started, and who were the founders?
Well, before I do that, in Weber County, we had a Weber County Medical Society formed. In 1891, Dr. John Driver was the president of the society, and that society met now for over 100 years. And it still is functioning, and the doctor members of the community, for the most part, are members of that county medical society. That society is designed essentially as a collegial organization and political medical organization. It works with the Utah Medical Association and the American Medical Association to further medical, political issues, and it still functions. But in addition, yes, there is another medical society in Ogden called the Ogden Surgical-Medical Society, which was founded in 1946. Now, the origin of this Ogden Surgical-Medical Society came about in the old original D Hospital. Three of the doctors in the hospital, Dr. George Pfister, Dr. Ezekiel Dumke, and Dr. Clark Rich, who were practicing there, and it being really the only hospital in Ogden in 1946, met together in the cloakroom of the hospital one morning. The date of exactly when is not clear, but just on a social basis, they began to talk, as doctors do in the cloakroom or in the lounge or wherever they meet nowadays. And they talked about, wouldn't it be nice if we could get some of our former mentors and doctors that we know of some notoriety or fame to come here to Ogden and teach things to the doctors who are here on an annual basis or some kind of a basis, so we can continue education for our doctors in Ogden. And so they decided that they would each call and invite a doctor that they were familiar with and invite him to come that year to be a lecturer to the doctors in Ogden. Well, it was kind of short notice. If they were meeting in April and if they were going to try to have a meeting in May, calling their doctor friends in Chicago or Louisiana or wherever, asking them to come the next month to present a lecture, that's kind of short notice. So they were not able to get all of the doctors that they contacted, but they did get several. And some of the speakers that they contacted were Dr. Charles Huggins, who later earned a Nobel Prize in Medicine in 1966, Dr. Alton Ochsner from Tulane University, Ochsner Medical Clinic in New Orleans, but he was not able to come that year. However, he came every year after that for about 20 years. Also, I'm looking for some of the others that were invited, but and Charles Mayo from the Mayo Clinic was invited also that first year. Over the years, other notable physicians have been invited. That first year in 1946, the meetings were called the Spring Surgical Clinics. Well, there were about 38 members who signed up for that original lecture clinic. And they were all the original staff of McKay-Dee Hospital. Well, word got around and they ended up with about 88 people attending the meeting, which was held in like the nurses' teaching room. So it was overcrowded. They realized they were going to have to get larger space to hold the meetings. So the next year in 1947, there were 138 members of this society, and the name of the society was changed to the Ogden Surgical Society. The meetings were held that next year at the Ben Lomond Hotel in downtown Ogden. But that even became not quite so suitable after a few years, and the meetings were moved to the Orpheum Theater on Washington Boulevard in Ogden. And then since that time, meetings have been held in a variety of places, including Weber State University and the Hilton Hotel, I believe it was at that time, down in downtown Ogden, and at the Union Station in Ogden. And then most recently we've been back. Then a new conference center was built in downtown Ogden, the Eccles Conference Center. and we held meetings for many years there. But most recently, for the past 2 or 3 years, we've come back up to Weber State University for our meetings. So that's some of the things that have happened with that organization. The 3 founders, Dr. Pfister, Dr. Dumke, and Dr. Clark, were in those days general practitioners, but often general practitioners siphoned off into areas that they particularly liked. And so they were doing surgery as well as and delivering babies and so on. So that's how the name kind of came around. In about 1988, I think, the name was changed because it became apparent that the lectures were not just surgical lectures, but they were general medical lectures, including pediatrics, internal medicine, and any of the other specialties. And so some of the doctors who were coming to the meeting and were interested in those other things lobbied for a change in the name, which was done in 1988, and a change to the Ogden Surgical-Medical Society. There were some doctors that were a little unhappy with that. Of course, you can imagine they were mainly the surgeons, but that has been successful since then. We started out, as I said, with only 3 or 4 lecturers in 1946. Getting into the 60s and 70s, we would usually have 15 to 25 lecturers, which seemed to be a very manageable number. This past year, I think we had close to 50 speakers, which begins to be a management problem. So we always discuss this, but we like to get good speakers. We have a committee to organize the meeting and choose speakers, and we like to give the people of that committee an opportunity to suggest speakers that they know or that they have heard or that they have heard of. And so we do get very good speakers from around the country as well as from our own state. And that is a very nice thing that we can do.
Well, I have a question about how the society acted in especially the early years. It's my understanding that prior to the current convention-like activity, that the speakers were usually hosted by a member of the society and actually stayed in their home and perhaps entertained by that host. Could you explain how that worked?
Thank you for bringing that up, because I have personal experience with that, with speakers staying in my parents' home when I was a child. And so we were able to, and the speaker would often, usually in fact, come with their spouse. And so in this instance, my mother would entertain the spouse, take her to see whatever was of interest in the city and the surroundings. My father would host the speaker that was staying with us. They would stay in our house. We didn't have hotel expenses for many of the speakers then. And then we would do some entertaining. There was other entertaining that went on also. That since the spouses were often coming to the meeting, and in those days, most of the physicians were men, so their spouses were women. And so there were women's activities that were put on as well, such as luncheons, fashion shows, art shows, musical shows, plays, to entertain the women that were there that didn't want to go and listen to the medical meetings themselves. So that was very interesting and nice. And we had then in the Ogden Standard Examiner newspaper, it seemed to me to be more community oriented, and there was actually a society section in the newspaper each week that was usually 2 full pages, both sides, and there would be information about these activities for the women that were going on. It would show pictures of them and their various activities of luncheons and open houses and garden parties and things like that. And this meeting has always been the largest attended convention in Ogden. And back in those days, and I'm speaking of like the 50s and 60s and early 70s, it was a really big deal socially and in the community.
Val, it sounds like throughout history, the speakers weren't the only exciting things happening about this meeting. It seems like it was just the whole community got around it. And I remember hearing some things that kind of were funny about the conference. Specifically, I think a travel agency was setting up a display table without permission or something like that.
Oh, yes. Yes. I don't remember the exact year, but our administrator for the society, our executive director, was Kenneth Knapp. And he had been the administrator of the D Hospital and originally the McKay D Hospital in Ogden. And he was a professional administrator, and he retired and then became sort of a part-time administrator for this Ogden Surgical-Society. And he was interested in raising money to help finance the society. And he, over his years as administrator of the hospitals, had met families in town of note who had money and was able to go to them and raise about $200,000 over a period of about 2 years to put into the funds of the Surgical Society. So on one of the years at the meetings, I'm trying to think whether I should mention her name or not. She was a well-respected and liked travel agent here in town who had the largest travel agency as well. And she showed up at the first day of our meetings with palm trees and tables and posters, and she was in her giant Hawaiian muumuu and her giant travel hat. And this had not been authorized for her to set up a booth, to sell her travel agency. And so Mr. Knapp, our executive then, went to her and said, "We've not been notified that you were going to be here doing this. We have not authorized it. But if you would like to make a donation, we could consider this." And the end of that story is she did not show up the next day. So that's about all I can tell you about that particular story. Now, there have been some sort of uncomfortable situations occur in the past, awkward situations. And there's one or two that I can remember. One was a speaker, a lecturer from out of town who came here and after the meetings wanted to go to all of the national parks in southern Utah, Zion's, Bryce, and Grand Canyon. So we told that speaker that we would arrange for someone to take him and drive him and accompany him down to those areas. And he said, "No, thank you. That's all right." Well, then we did get a bill from him. He had hired a taxi to take him down to all of those places, and it had to put the taxi driver and himself up at a place to stay along the ways, and we received the bill for that. Now, we dealt with that, and I don't know the exact outcome, but we dealt with it. Another circumstance was, just a minute, I'm thinking of this one. We had a speaker coming from Sweden with his wife, and we ended up paying for a 2-night stay over in Paris so she could go shopping. So we've had some kind of awkward things like that occur. Those are the main ones that I can think of.
Val, thank you. Those are kind of funny stories. I'm glad that they haven't happened recently. Talking about some money, I'm wondering how the society is financed.
Okay, to begin with, back in the very early days with those original 3 doctors, they were friends with the speakers they were bringing in. And so in some of those instances, those doctors that were coming in as lecturers, they were well off and they could pay their own way to come in, and they were staying with their doctor friends here. So there weren't hotels, things like that to deal with. Shortly after that, dues were instituted because the organization was established as a society. So dues were begun, and I don't know how much, but I would guess they were probably around $25 back in those days a year for a member. Those increased to $50 over some years. And a person could come to those meetings without being a member, without paying dues. People from the community could come and sit in. But if you registered for the meeting, then you got certain benefits like meals at the meeting and some of the social activities that had entertainers that had to be paid and had meals. But the meetings themselves were free. And they are that way even today. For the public can come to our meetings and listen to the meetings, but they are not members. They would have to pay for meals if they came to one of the events where meals were available to them. And if they are not a member of the society and want continuing medical education credit, then they would pay separately to have continuing medical education credit, whereas the actual dues-paying members have that included along with meals and any other ancillary activities with their dues.
So the concept of continuing medical education and the requirements that physicians have now, the society itself came long before that concept had ever been brought up nationally. Do you recall at all what time frame it was that we switched from providing education to providing education with credits that physicians can?
I do not know exactly what the year was with that. I could refer the question back to someone who I think is on that committee and see if he knows the answer to that. But it would have, I know I was on the state accrediting agency for that in probably the late 1990s, and it was already in effect. So that's all I can answer there. But we provide out of these meetings, usually each year, somewhere between 22 and 26 hours of continuing medical education credit, which is sufficient to provide the requirement for licensure in Utah for physicians. Utah requires 40 hours every 2 years of continuing medical education credit. And if a person were to come only to this meeting, he would fulfill those requirements, as well as the least expensive continuing medical education that you can get anywhere. And the cost of the meeting, as we inquire every year from people, is the lowest price meeting that they have ever seen.
That was an excellent advertisement.
Yes, it is. Now, Val, as one of the newer members of the board of directors, I immediately noticed this when I first came to the meeting, and I was drawn to the different feel of this meeting that it had from all the other professional meetings I've ever been to. So can you speak a little bit about the transformation into what you call the enduring legacy of education and collegiality, which ultimately improves the medical condition for all in that community?
Well, it is a social experience. To me, it's probably the greatest social experience of the year for me. I have been coming to these meetings for a long time. My father was a physician, and when I was 17, he would take me to the meetings when they were here in May. So I would go there, but in those days also there were fewer doctors. You knew most of the doctor families in town. As a child, I knew the children of most of these other physicians. And so it was a social event, and I got introduced to that very early when I was about 17, when I was, I think, a junior in high school. And then after my medical training, I returned back here and have been to the meetings every year that I've been back here also. And I remember and know from before then, many of the doctors and their families, some are dying off, but it's still a social event. And we go to these meetings. Everyone is cordial. We have other avenues of meetings, of receptions, which are not directly medically related. We have picnics, banquets, entertainment programs, and this all lends towards collegiality. And I sense that we are, in general, in this country, losing a lot of that collegial feeling among physicians. There seems to be distancing. And this particular meeting that we have every year helps to keep us together as social doctors and as friends. And it lets us have informal consultations. We can talk with each other. We can bring up avoiding the HIPAA problems. We can bring up patients without having to identify them and discuss with other doctors that we might think have some ideas and suggestions that might be helpful to us. So it's a great collegial organization.
Totally agree with you. I felt that wholly with my entire time here. I have one final question for you. I wanted to talk a little bit about some of the more emotional moments of the conference. Can you remember or think of like the top couple of moments that affected you the most as a physician?
Oh my goodness, I just happen to have some things in mind. In 2017, one of our speakers was Elizabeth Smart. And people around here will recognize that name because all of us here in Utah lived through that experience that she had of being kidnapped and all the rest. And so she was a very interesting, personal speaker to us. And that was emotional to hear and remember back when the kidnapping and the finding of her was happening. We could recall in our own minds that we were experiencing that going on. We also discovered that she is a relative of some of our founding members in the Ogden Surgical Society. Now, another one was in 2018, one of our speakers, Gerda Saunders, was a woman with Alzheimer's. And she spoke as one of our lecturers to speak from a personal experience, her journey into having Alzheimer's disease and where she is now and where she expects this will be going. That's a very emotional thing to listen to from a person who has the disease. Another one was in 2018, we had just had the death of one of our board members and past presidents, Rhonda Lair. And so at our meeting, one of her doctor friends, Dr. Grace O'Brien, gave a tribute to her as past president of this organization. And the story there was an interesting story. And the story was when this person, when Rhonda was 18 years old, her family had planned a trip, a cruise, on a cruise ship. And everybody was thought to be going on the trip. And for some reason, Rhonda decided not to go on that trip with her parents. And that ship went off the coast of Florida, caught fire, burned, and sank. And her parents were killed on that cruise. And you've probably all heard the song, The Wreck of the Edmund Fitzgerald by Gordon Lightfoot. Well, he wrote another song called The Ballad of the Yarmouth Castle, which was the name of that ship that sank in 1965 with one of our past presidents of the Surgical Society, parents and family on it. That was emotional to hear. Then finally, we had a speaker in 2018 also. He's an emergency room physician in Ogden, and he spoke about compassion in medicine. The title was, Everybody is Someone's Someone. And he talked about emergency experience, and this one in particular where he was serving in the emergency room. A male, I think around 56 years old or so, came in, was brought to the emergency room, the victim of an auto pedestrian bicycle accident. He was unrecognizable. They worked on him. They were unable to save him. They couldn't recognize the patient because of his condition. But this doctor, emergency room doctor, caring for this patient, then noticed that the watch on the patient's arm was his father's watch. And so that was very emotional. That's how he then knew he was actually trying to save his father. And those are enough to talk about.
Val, thank you for that. This conference really, to me, it really does stand out as extremely unique because nowhere else do we get this kind of collegiality between different specialties of medicine. It's not only about getting to talk with your peers, but it's also about the knowledge that you gain, and you get some emotional connection there as well. Thank you so much for your insight and your perspective. It's truly invaluable, Val.
Well, thank you. We've had many notable and well-known speakers at the conference that many physicians have heard about. We had Dr. William DeVries here. He was the surgeon who operated on Barney Clark, which was the first artificial heart implantation. And that Dr. DeVries is from Ogden, as a matter of fact. We had Dr. Mario Capecci from the University of Utah here in 2007. He was Nobel Prize winner. We had Donnell Thomas from Seattle, a Nobel Prize winner who developed the bone marrow transplant, and who I had the privilege of working with in my residency. We've had other names that you would recognize if I were able to spiel them off. Charles Mayo, Charles Huggins, Alton Oxner, George Cryle, Alfred Blaylock, Michael DeBakey, Maxwell Winthrop, Frank Leahy, Henry Swan of the Swan-Ganz catheter, Owen Wangenstein of the Wangenstein pump or something, I can't remember. George K. Hill, Kenneth Cooper, Louis Goodman, who was a co-author of the pharmaceutical textbook used for years. William DeVries, as I mentioned, Lester Dragstedt, and others. So we've had notable speakers. These are not, people that we just bring in off the street and say, will you give a talk today? So it has been exciting to go and participate in this.
Well, Val, thank you again for sharing these stories and this history. It really does mean a lot, especially as we're going into different new situations. It's great to have a perspective and a foot back into what has happened and to know kind of what we can possibly expect in the future. So thank you very much.
Thank you, Scott.
Thank you.
This was produced by Clark Madsen, MD, MS, Teresa Puskedra, MPC, and the board of the Ogden Surgical-Medical Society. The executive director was Teresa Puskedra, MPC. Our host tonight was me, Scott Moore, DO, and Brian Campbell, MD. The editing and sound design was by Colton Gomez, and this is all supported by members of the Ogden Surgical-Medical Society like you.